want to show you more human research and fundamental research to have a different point of view of the interest to have genetic diagnosis for families and patients who presented with hearing loss or hearing impairment. So I will first, sorry, I have a problem with my slides. Okay, that's okay. So I just want to explain you the way our which is the way of our consultation is organized since more than 10 years, I think. The first consultation, the patient and his family see not only clinical geneticists, but several professionals, as a psychologist first, then the nurse, the genetic counselor, and then the clinical geneticist specialized in deafness. And when Laurence gets an etiology for us, we have a result consultation. And in this result consultation, there is even the genetic counselor, the clinical geneticist, or if the diagnosis is severe, or if there is a pregnancy, for example, also the psychologist. And I have just a slide about our molecular strategy in France. So we decide to start the whole exome sequencing first, only for syndromic or malformative hearing loss. In malformative hearing loss, I put all the malformation of inner ear because, like Annie has shown us just before, there is evidence that we need to look at non-coding region for inner ear malformation like EVR, but also other inner ear malformations. And in unknown association between hearing loss and other clinical signs, oftenly we found two different pathologies. So it's very important for us to start the whole exome sequencing without panel with this indication. So I will now go for in the result of our research. So it's a research about the answers to a questionnaire that have been sent or that have been attached to the genetic medical report for 2 years in 2018 to the end of 2019. And we could have more than 100 answers from our patients. For all patients, they had a genetic etiology of the hearing loss, even in their child or for their own hearing loss. So if we look at the responders to the form, we have a majority of mother of deaf child, but also 10% of father of the deaf child, but also about 20%, in 20% it's the adult which who is deaf. So we have a majority of parents who have answered to this questionnaire. We have looked to the severity and the specificity of the hearing loss of the patient. So for a lot of them, the hearing defect is bilateral, and for 16.4%, it's non-syndromic, which is quite the reflex of our consultation. We have asked about the time frame since the consultation for results, and some results have been sorry, I've lost my word. Have been done to the transferred to the family 5 years ago, but the majority, the molecular diagnosis have been done for 1 year, since 1 year to 5 years. So we would like to know who was present during the consultation for the genetic results, and like you see, there was the responder to the questionnaire was there, but also in the vast majority is partner, and in half of cases the deaf child, but not in all cases, which is quite surprising for me. Sometimes also hearing child are present, and other person are not present in the consultation. During this consultation, we ask if the person would like somebody to be present. For 16%, they say no, nobody else. But as you see, some persons that have responded to the questionnaire say they would like to have also with them some other members of the family, or the grandparents, or some friend, for example, but it's quite unusual. So we ask about the timing of the consultation, and in their opinion, because it's not always true, but in their opinions, the consultation was duration from 1/4 to 1 hour. And in my experience, this consultation take about half an hour. So we ask about the explanation during this consultation, and as you see, a vast majority of parents or deaf patients say it was clear, very clear, or rather clear, and they rather easy understand the explanation of the clinical geneticist. So we wanted to know if they remember what was explained during the consultation. So they remember that the etiology was explained, and also the recurrence risk for their future child or for the future generation, the prognosis of the hearing defect, the association or not to other clinical signs, and in about 10% the possibility, or I guess the impossibility, to have a special treatment. So as we see, the vast majority of the respondents say that the expectation was were answered. And we will we did we wanted to know if they want another genetic consultation after the first one, during which we have tell us about the etiology of the deafness of the family. For about 70%, they say no. They didn't have any consultation after the first consultation for results. And some of them, 20%, have another consultation with the clinical geneticist. And about 12% had several consultations with us. And we asked if there was not a second consultation. Would you like to have another one or not? And for half of them, they say no. But for half of them, they say yes. Yes, in the far future for 27%. Yeah, yes, in the near future in 18%, and very rapidly in 8%. We would like to know if they talk about the genetic results in their family or with their friend. And so we ask if they did. And they talk about this genetic result with their partner, the parents, so usually the grandparents of the deaf child, their siblings in the vast majority of the cases, but also with friends, and in 40% of the cases with the deaf child and hearing child. So we ask about their interest in the genetic results about hearing loss, and they say it was important for themselves, their partner, the deaf child, their deaf child, but also for other members of the family, for the hearing child, and for the hearing child, for an important number of them. And they think also that determining the cause of the child deafness will be important for the perception of the child future, for their future pregnancies, but also for the medical care of their deaf child in 22%. But in 41%, they think that there is no change after the determination of the cause of the deafness. We asked about their feeling about the determination of the etiology and the genetic consultation of results, and the majority of them had good feelings. They were reassured, they were revealed, but some of them were guilty. They feel anxious or lost, sometimes angry, And we ask about the feeling, but not about themselves, but regarding the child. And so they are confident in most of the cases, concerned, reassured, but sometimes also anxious and angry. And in this slide, we have asked people, the parents or the patient, to give us just a word to resume the consultation and the discovery of genetic cause of the deafness. And as bigger is the word, as frequent is the word. And I put also colors, odd colors for good feelings, and cold colors for bad feelings. So you see, the more frequent word, it's clear, but also satisfaction, essential, denouement, perfect, and relief. So with this questionnaire, we can see that patients in the vast majority are satisfied with this consultation, and it's a source of information for them. Most of them have not seen a professional after this consultation of announcement. So as half of them would have liked to see some people, some genetic people after this first consultation, we decide to give systematically a document with the contact details of the genetic counselor, of the psychologist and the psychologist after this consultation, to be sure that they can contact us easily for a second or third consultation after this consultation of results. And we ask if one consultation is not too dense and complex, and but we can see also a great inter-individual variability of the feelings, but they are globally positive when they have this consultation of results for the genetic etiology of the deafness of the child or their deafness. So I think it's the last time. Okay, so I thank all my network, all the patients, and the psychologists that who work with me daily. Thank you.